Hi, so this is cultural differences in the pre-hospital care. So, Canada has become a very diverse place. In the 2021 Canadian census, found that the number of practicing Christians is falling, and some of the non-Christian religions have doubled between 2001 to 2021. It has also found that permanent resident immigrants hold 23% of the Canadian population. Paramedics face a variety of calls from each shift, from trauma to medical to lift assists. With Canada's growing diversity, paramedics will be presented with patients from many different cultures. It is important to understand how these cultural differences can affect pre-hospital treatment. So these statistics are from the Canadian 2021 census. 53.3% of the Canadians are Christian, but this number has actually been decreasing throughout the years. The proportion of Islam and Hinduism has doubled from 2001 to 2021. Islam is now the second largest religion in Canada at 4.9%. Hinduism is the third largest religion in Canada at 2.3%. Sikh has also doubled from 2001 to 2021 and is now at 2.1%. And the Jewish population has actually decreased down to 0.9%. Ontario and British Columbia have the biggest proportion of non-Christian religions, so this would mean that paramedics within these regions are more likely to face these different cultural diversities. So this is a statistic from Statistics of Canada, and it's from 2017 to 2019. In this picture, you can see the drop in the Christian religion. You can also see the increase for the Sikh, Muslim, and Hindu religion, and you can also see the decrease in the Jewish religion. So I want to talk about Hinduism. So Hinduism is a religion that is over 4,000 years old, originating in India. Hinduism believes in the existence of multiple gods and goddesses and follow the sacred text called Vedas. Hindus recognize that their religion is a way of life. They believe in life, death, and reincarnation. Hindus strongly believe in karma and that one's actions will determine what happens in their life. There is a belief that this karma can also pass from soul to soul and affect one into the next life. In Canada, as we stated before, it is the third most common religion at 2.3%. On the right side of the screen, you can see this is Lord Ganesh. He is an important god in the Hinduism culture. So Hindus may choose to dress modestly. Before performing any examination, paramedics should always gain consent. Hindus may be reluctant to be examined by members of the opposite sex or reluctant to expose their body. Paramedics should try to potentially bring along a third party in order for these examinations to be performed if you're not of the same sex. This could be a sibling, a parent, or a spouse. It's always best to communicate with your patient before just assuming they may have these reluctance. In Hinduism, the belief in karma is very strong. Many Hindus may believe their pain, illness, or injury is an act of karma. Therefore, a patient may try to downplay pain or even refuse treatment as they believe it is a consequence. Paramedics should respect the patient's right to refuse and monitor their patients closely while operating within guidelines and rules regarding refusals of treatment of care. So, religious clothing. Research analysis at the Pew Research Center conducted a study from 2019 to 2022 about religious clothing and personal appearance among adults in India. This study found that 52% of Hindus wear a religious pendant. This could be an amulet, a cross, some form of jewelry that may have symbols or images of God. Among women, 59% wear a head covering and 84% wear a bindi. A bindi is a decorative mark on the forehead, usually representing the third eye or a sign of marriage. Among Hindu men, 53% wear italic. This is also another form of forehead marking. So when examining these patients, you may come across these religious items and garments. It is always best not to remove these religious items and garments unless they are interfering with your examination. If you must remove them, it is always best to ask for permission or consent beforehand if the patient is awake and unaltered. And always treat these items with respect and ensuring they go into the appropriate safe spots. So on the left here, this is an example of a bindi. These represent the third eye, thoughts of God, or can be a sign of marriage. The tilak on the right hand side here can represent devotion to God or respect to God. So again, religious pendants, jewelry, clothing, and head coverings should never be removed unless interfering with treatment. Ensure when applicable to ask for consent to remove the item and ensure you're keeping it, you're respecting the item and it doesn't wind up on the floor or anything like that. So in India, they have a population of 1.3 billion and 80% of the population practices Hinduism. Within India, studies have found harmful genetic variations and disorders. There is a couple theories for this. One is potentially the founder effect, and the founder effect is when a population has common ancestry without much genetic diversity. So the Indian genome variation provided and collected data about the genetic variations and susceptibilities. So it was found that some Indians have susceptible genes to causing Parkinson's disease, Wilson's disease, and albinism. Parkinson's disorder affects the nervous system, resulting in symptoms like tremors, bradykinesia, rigid muscles, speech changes, and more. Wilson's disease is copper accumulation in the liver, brain, eyes, and potentially other organs. This can result in symptoms like tiredness, yellow skin, fluid buildup, speech issues, uncontrolled movement, and more. And then albinism is little to no melanin in the body. So there are other common pathologies such as blood disorders like sickle cell anemia and thalassemia. Sickle cell anemia affects the shape of the red blood cell, resulting in pain, swelling, infection, and the body not getting enough oxygen. Thalassemia causes the body to have less hemoglobin, resulting in fatigue, weakness, yellow skin, facial deformities, and other symptoms. Within India, the birth rates of babies born with Down syndrome are also higher. And then there's also risk for other genetic conditions like other blood disorders, cardiomyopathies, and neurological disorders. So I want to talk about Judaism next. Judaism is a religion that began with the Hebrew people in the Middle East 4,000 years ago. The Jewish culture's main sacred book is called the Torah. The Torah has 613 commandments. One of the commandments is that there is only one God and that Jewish people can only worship this one God. There are different branches of Jewish people. There are the Ashkenazi Jews, which are primarily associated with Jews from Central and Eastern Europe, and Jews who immigrated to North America. The Sephardic Jews were Jewish people that settled in Amsterdam, North Africa, and the Middle East after being expelled from Spain by Queen Elizabeth in 1492. The Mizrahi Jews come from Middle Eastern ancestry and live today in the United States and Israel. From the statistics of Canada, 0.9% of the religions in Canada are Jewish. So So, couple in-hospital needs for Jewish people. In Jewish culture, Jews are taught to take care of themselves and usually have a positive attitude towards medical care and treatment. In hospital, the most significant needs of Jewish patients are respect for holidays, kosher meals, and modesty. Shabbat is a Jewish holiday that occurs on Saturdays from sundown Friday to sundown Saturday. It's a day of rest where Jewish people abstain from working, shopping, using phones, computers, and more. This day is used for prayer and reading. While in hospital, nurses should ask if the patients need anything to help them participate in Shabbat. Kosher meals are vegetables, fruits, grains, nuts, cattle, sheep, and more. Kosher is also dependent on how the animal is killed. Usually hospitals will be able to provide kosher meals. Modesty can be important in Jewish culture. Jewish patients may ask for the same sex to perform an examination or be in the room for the examination. Some Jews may vary in how strict they follow Jewish culture, so it's always best to ask the patient what they need before just assuming. So the modesty, again, they may want a same-sex paramedic, which may not always be feasible, so you'll just have to communicate with your patient in order to give them the best. In the lower right corner here, you can see a family celebrating Shabbat. So, religious clothing. Paramedics should be aware that Orthodox Jews and potentially other Jews may wear a kippah or a yarmulke as a sign of respect to God. If a paramedic has a Jewish patient who wears a kippah, it is essential only to remove it if it's necessary. If a paramedic has to remove the kippah, again, they should always gain consent first, if applicable, and treat it with respect and make sure it's in an appropriate place. These are pictures of what a kippah and a yarmulke can look like. So, common pathologies within the Jewish culture. So, specifically, Ashkenazi Jews have a higher carrier rate for more than 40 different genetic diseases. 1 in 3 Jews is a carrier of up to 19 different genetic diseases. Again, it'll depend on the origin of country for what these Jews may be at risk for and for how at risk they are. It is believed that the founder effect may potentially have caused these genetic conditions. And again, the founder effect is a population has common ancestry with little genetic diversity. So these are examples of some common pathologies. So there is Gaucher's disease, which is a buildup of fatty substances in the organs, resulting in abdominal pain, skeletal abnormalities, and blood disorders. Cystic fibrosis, which damages the lungs, digestive tract, and other organs with sticky, thick fluid. This can result in coughs, wheezing, infections, and more. And then there's Tay-Sachs disease, which is a buildup of fatty substances in the brain and spinal cord, resulting in nerve damage. These symptoms can be seizures and a loss of motor, hearing, vision, and other neurological symptoms. With this disease, the symptoms can also depend on the age of the patient. So for newborns or infants, it might be different than for full-grown adults. There's also other genetic diseases and disorders that are a possibility with as well. Okay, so Islam started in Saudi Arabia and quickly spread to many other countries, becoming the second largest religion in the world. Islam is the second largest religion in Canada. And so the Muslims believe in one God, Allah, which is the Arabic word for God. Muslims' sacred book is the Quran. The Quran came from a prophet named Muhammad after the angel Gabriel visited Muhammad and told him the word of God. Oh, I'll go back. On the bottom corner there, that is the Kaaba, which is a sacred spot within the Muslim cultures in Saudi Arabia. So, religious clothing within the Muslim culture. Muslims will typically dress modestly. This means loose-fitting clothing, some religious garments such as a hijab. According to the Pew Research Center's religious clothing study in India, 89% of Muslim women wear a head covering outside the home. Muslim women may wear other forms of modest clothing, such as a burqa. Muslim men may wear a skull cap. Muslims may also wear religious pendants and jewelry. When treating these patients who may be wearing religious jewelry, as we've spoken about before, it's always best to gain consent before removing them, only removing if they're in the way of examination and respecting the item upon removal. So on the left here, you can see a burqa, which is the loose fitting garment covering the whole body. On the right hand side here is a woman wearing a hijab, which is a head covering. So within pre-hospital treatment, modesty is quite big in Muslim culture. Modesty and physical contact rules may vary from patient to patient. A paramedic should always communicate with their patient and ask what can be done to respect their religion and their modesty rules and preferences. It is common for Muslims to prefer to be examined by members of the same sex. Again, in pre-hospital care, providing a paramedic of the same sex is not potentially possible. So a paramedic may have to bring along a spouse, a sibling, a parent for the examination, or having a third party member of the same sex may also be preferred by the patient. For example, if there's a firefighter on scene of the same sex of the patient, maybe bringing them if that's what the patient wishes. So common pathologies within this culture. So there are several genetic disorders and conditions that are common within this culture. Hemoglobin disorders, metabolic disorders, neurological disorders, and congenital disabilities are also possible genetic conditions within the Muslim culture. In some Arab countries, the rates of children born with Down syndrome is higher as well. This is thought to be due to a couple of factors. Parents have large families and continue to have children later on in life. So in Arab countries, 50% of the children born with Down syndrome are to mothers who are 40 years or older. Sickle cell anemia is also prevalent within this culture. Again, sickle cell anemia changes the shape, texture, and lifespan of a red blood cell, which can result in blockages or not having enough red blood cells. The patient may present with pain, infection, swelling. Paramedics should be aware that this patient may be dealing with a genetic condition. Okay, so in the 2021 Canadian census, over 200 languages were recorded to be spoken, and the most common languages next to English and French were Mandarin, Punjabi, Yue, and Spanish. So there has been an increase in different languages from 2016 to 2021. Hindu has increased by 38%, Punjabi by 33%, Gujarati by 28%, and Spanish by 28% as well. So working around a language barrier, paramedics should be knowledgeable on how to deal with language barriers. Paramedics should utilize bystanders, potentially by getting friends or family to translate. Google Translate may also be used to communicate with a patient, and other forms of nonverbal communication should be used as well. Acting things out like performing them on oneself before doing it on the patient. For example, putting a blood pressure cuff on your own arm before applying it to the patient's. So how this relates to paramedicine, these statistics, studies, and research projects have all been based out of non-Canadian countries, but the potential to see these religions, clothings, beliefs, and pathologies are still a possibility. One of the things that all three of these religions that I spoke about had in common was their modesty aspects. When doing examinations like a rapid trauma or an abdominal palpation or a 12 lead, it is important to ask first and see what your patient is comfortable with. Awareness of genetic conditions are also important. Being aware of these potential for genetic conditions can help paramedics lead to a working diagnosis, as well as ensure the patient will be getting the correct course of treatment. Understanding cultural differences can result in a well cared for patient. The realm of paramedicine is already difficult. Paramedics should be aware of cultural differences and how they may have to adjust treatment plans for different cultures. Being prepared when a patient has special religious requests or needs is more desirable than being blindsided. A plan to accommodate these cultural differences will make a paramedic's job more manageable and a patient feel safer. In all, a paramedic's job is to help people. The end goal is to make sure a patient is comfortable, respected, and well cared for. So that is my presentation on cultural differences in pre-hospital care. Here is a list of my references. And that's all. Thank you.